The relationship of brachial plexus is often considered to be a difficult topic to learn, but it is not correct, because if you understand the structures around it, relations are to learn the relationship is very simple. Now let us have a look at the structures around it. Now here you can see the vertebrae facing forward. So what you see here is the body of the vertebra. The intervertebral disc can be seen, the transverse process is seen, and you can also make out the corresponding spinal nerves coming out from the intervertebral foramen. So these are the C5, C6, C7, C8 and T1 spinal nerves coming out from the intervertebral foramen. Now this is the first thing you have to understand. So you have studied the body of the vertebrae and the corresponding spinal nerves coming out. Okay. Now point number 2 are the other bony structures we see here. You can see to the first thoracic vertebrae, you can see the first rib. Can you see the first rib here? Okay. This first rib curves around and articulates with the manubrium sterna here. Alright. So this is the what you see as a curved structure here is the first rib. Now you can also make out a muscle getting attached to the first rib. This muscle is called as the scalenus anterior. Okay. Can you see the scalenus anterior? Arising from the transverse process of the 5, 6, 7 and all the way going and getting inserted to the first rib. Okay, this is another thing you have to understand. Now we can also make out the clavicle running in front. You can palpate your clavicle very well. You can palpate your clavicle. So the clavicle is running in front or superficial to the first rib. That means the first rib is deep to the clavicle. So you can trace the clavicle all the way laterally. You can do it simultaneously with your hand while I move the cursor, and you can see it is articulating with the acromion process of the scapula. So scapula is seen behind. That's acromion process of the scapula. Also you can make out the coracoid process of the scapula here facing forwards. So this is the coracoid process of the scapula, and the body of the scapula is behind like this. And you can also make out the humerus, head of the humerus articulating from the shoulder joint. So these are the major bony landmarks which you have to understand before studying the relationship of the brachial plexus. One more thing I forgot to add is the artery. You can see an artery, the subclavian artery coming out along with the brachial plexus, and once it reaches the axilla, we call it as the axillary artery. So this is the axillary artery. So these are the major things you have to understand before learning the relationship of brachial plexus. Now let us come to brachial plexus per se. We all know that the brachial plexus is formed by roots, trunks, division, cords and branches. So this is a known factor which you can check for yourself. Now what happens in this case? The roots, that is C5 and C6 roots, forms the upper, C7 forms the middle, C8 and T1 forms the lower trunk. So you can see the roots are seen deep to the scalene muscle, anterior scalene muscle, correct? It's seen deep to the anterior scalene muscle, while the trunk, upper, middle and trunk, lower trunk are seen between the lateral border of the scalene muscle and the clavicle. So the trunk is between clavicle and scalene muscle. Now as it goes, the trunk divides. Understand that the trunk divides deep to the clavicle. Can you see the divisions which is happening deep to the clavicle? Alright. So once it divides, it forms the cords. Now you have the lateral, posterior and medial cord. These cords are named in relation with the axillary artery, which is also seen in the axilla. You can see the posterior cord will be seen behind the axillary artery, lateral and medial in the corresponding sides of the axillary artery. Finally, it forms the branches. So in a nutshell, what you have to understand, the roots are formed deep to the scalene muscle. The trunks are formed between the scalene muscle and the clavicle. Division happens deep to the clavicle, and cords are related with the axillary artery. So in this way, you can very well make out the relationship of the brachial plexus with its corresponding structures. Thank you.